number 9. I've been suffering from a fluoroscopy-guided pudendal nerve block a year and a half ago. And now I can't sit or stand without pain. Did the doctor damage my pudendal nerve with this shot? The doctor wants to do Botox on me. Is that a good idea for pudendal neuralgia or not? Also, could the block have entrapped my nerve? So I have heard in the past of patients whose pain worsened after the pudendal nerve block, really regardless of the way it is done. And patients believe that fluoroscopy done block may be less precise than CT guided, then there's a higher likelihood of this happening. I think that the likelihood of directly hitting the nerve with a needle is very low. Of course, neither on fluoroscopy nor CT nor MRI nor ultrasound we actually see the nerve, and the general idea is to inject the local anesthetic and sometimes steroid around the nerve and not, of course, into the nerve. You are asking if Botox is a good idea. Well, it really depends if your pelvic floor muscles are tight. So I do believe that doing the block may have actually irritated and tightened the muscles, and that may be the reason why your pain is increased, not because there was a direct injury to the nerve. So to answer your question, do you need a Botox injection? Before you make that decision, you need to see the pelvic floor physical therapist, and you need to be assessed if your muscles are tight. And if they are tight, you probably need pelvic floor physical therapy first before going on with Botox injection. You may also benefit from some rectal or vaginal suppositories with diazepam and baclofen and Valium. So the second part of the question, did the block permanently entrap my nerve? I think in cases where you, for example, hit the vessel with a block and there is bleeding into the area of the Alcock's canal or bleeding into the area between the ligaments, there may potentially be a scarring caused by that bleeding. But if your pain was immediate after the block, it is more likely to be the muscle spasm than the scarring that takes time to form. So I really encourage you to see the physical therapist first before doing any other procedures. And then I suggest doing the physical therapy for a couple months if there is muscle spasm. And if there is not, then Botox would be a good idea. If there is no improvement, meaning you still have pain but your muscles are relaxed, that's generally when I assume that there may be some injury to the pudendal nerve. But I do not jump into the surgical procedures right away. I recommend doing amniotic allograft injections. Amniotic allograft are the tissues that are obtained from the placenta, and amniotic membranes. Those are obtained during the cesarean section. There is a company that will process those. They'll screen them for viruses and all the other diseases, and those can be injected around the pudendal nerve to help the nerve regenerate. There are growth factors in there that may allow the nerve to regenerate without surgery. They are also very strongly anti-inflammatory, and therefore when they decrease the inflammation around the nerve, they actually may help the pain without the surgical procedure. And only if you have gone through physical therapy, if you have gone through botulinum toxin treatments, through allograft injections, and the pain still persists, this is the time when I would suggest talking about the pudendal nerve decompression surgery.